Knock, knock, knock. Perform hand hygiene. Hi, my name is Maya. I'm a student nurse at Chaffey College. I'm here to do a head-to-toe assessment, which is an overall, just an assessment of how you're doing, your overall conditions and things like that. So I'm going to provide patient privacy. I'm going to check the floor for any loose wiring or IVs that may be on the floor and any unknown fluids or liquids that potentially can be a safety hazard. Okay, everything looks good. And may I ask your name and your date of birth? Okay, I'm gonna check that. And do you have any known allergies, any food or drug? No? Okay, make a note of that. And do you know where you are or the time of the day? Do you know why you're here? Okay, so with your permission, I'd like to get started on the head-to-toe assessment. So I'm going to raise the bed to accommodate my height. I'm going to lower the bed rail so that I could reach you better. And I'm going to go ahead and don gloves. Now, on a scale of 0 to 10, 0 being no pain and 10 being absolute immense amount of pain, how would you rate it? Okay, and how about the quality of your pain? Is it dull, burning, aching, throbbing? Okay, can you tell me where it's located and if it radiates anywhere? Is there something that maybe causes the pain to worsen or lessen? Are you able to be mobile with that pain? Okay. Alrighty, no pain, so then you won't need any pain medication before we get started. And I'm going to go ahead and start off with your head area. Have you been in any accidents or any trauma as of late? No? Okay. I'm going to check your scalp for any flaking, any scarring, anything I should know about. Any alopecia, patches, missing clumps of hair. Okay, I'm going to palpate for any masses. Okay. Alrighty. Everything looks good. Okay. Now I'm going to just take a look at your face, make sure everything's symmetrical, make sure there's no drooping. Okay, everything's symmetrical. Looks good. Let's go ahead and move to your ears. I'm going to check for any occlusions, make sure any bugs or anything aren't stuck in there. Any hearing aids? Are you hard of hearing? Do you have any of those devices? No. Any cerumen impaction or lesions? I'm going to also check behind the ear, make sure that bony prominence is intact. Okay. And make sure there's no drainage, any CSF or blood. I'm going to also do the other side. If I can't reach, I'll go to the other side of the bed. All right. Everything looks good. So we're going to move to your eyebrows. No lice or anything going on there. Okay, so now we can move on to your eyes. Do you have any contacts or glasses? Any blurred vision? Anything like that? And I'm going to check your conjunctiva, make sure that it's not red or inflamed or draining on both sides. Make sure that the sclera doesn't have any yellow tinge, or if it's inflamed or red. Anything maybe bothering your eyes a little bit? Nothing? Doesn't feel like something's stuck in there? No? Okay, so I'm going to go ahead and perform a test called PERLA, which is pupils equal, round, and reactive to light and accommodation. And it's just where I'm going to briefly shine the light in each eye, and I'm going to check and see how fast and how much the pupil constricts. So I'm going to go ahead and dim the light. So if you go ahead and just look forward for me, I'm going to briefly flash the light in each eye. Okay, other side. Okay. The pupils read to be 3 millimeters, which is normal. The constriction was brisk and present, so that's good as well. I'm going to turn back on the light. And now we're going to do accommodation, where you're just going to look straight ahead like before, and I'm just going to place the pin directly in front of you, and you're just going to briskly look at that. Okay? All right. Okay. Your pupils responded briskly to that. I'm going to go ahead and take a look at your nostrils. Turn on the pin light and look through each nostril to check for a deviated septum or any polyps, any draining of any kind, and note the color and consistency of that drainage. Do you have any sinus issues or any allergies or chronic or acute? No? Okay. So now we're going to move down to your oral cavity. I'm going to place my pin light down, and I'm going to use my tongue depressor. If you can just say ah for me and stick out your tongue nice and big. I'm going to check the tongue for any inflammation, any cracking. Okay. Do you have any dentures or any missing teeth? Okay. I'm also going to check for dental caries. All right. Make sure that the mucosal membrane is pink and moist. And make sure that there's no yellow or white film, which can indicate candidiasis. Can you lift up your tongue for me? Look underneath there. Okay. And how's your swallowing? Are you able to swallow okay with no difficulties? No burning sensation or difficulties? Okay. How about tonsil removal? Do you still have your tonsils intact? You do? Okay. Make sure that the lips aren't dry or chapped, cracking, bleeding. And make sure that there's no cyanosis, which can indicate an oxygen issue. So I'm going to deglove, perform hand hygiene. What I'm going to do now is I'm going to check your carotid artery on each side, okay? Check that. Okay, I'm going to check the other side. I'm going to be sure to not do both sides, which could occlude the circulation to the brain. Okay, looks good. I'm going to go ahead and take this time to listen to your carotid arteries now. So if you can do me a favor and hold your breath, I'm going to check both sides of your carotid arteries, and I'm looking for sound, whooshing, swooshing sounds that indicates an abnormality. So hopefully we don't hear those things. Okay, here we go. Hold your breath. Okay, other side. Okay, perfect. No whooshing, swooshing sounds. That indicates everything is normal. So I'm going to go ahead and check your extremities. If you can just put your palms face up for me. I'm going to check your skin. Make sure that your skin is applicable to your race or ethnicity. There's no abnormalities, no inflammation, bumps, hives, cracking, over moisturization. Okay, I'm going to also take this time to check the skin turgor, where I'll gently pull up on the skin to check for tenting of more than 3 seconds, which would indicate dehydration. Under that would recoil. And everything looks good. So I'm going to go ahead and check your pulses on each side. The brachial, radial. Okay. Check the antecubital areas. Make sure there's no eczema or breakdown in between the crevices. Okay. Go ahead and flip over. I'm going to check your motor strength. Go ahead and squeeze as hard as you can, both sides. Okay. Flex back for me. Now push down. Perfect. Now I'm going to check your capillary refill. I'm going to squeeze both nail beds, both sides of your hands for the blanching, and check for a brisk return of the pink. Under 3 seconds would indicate good circulation and oxygenation. Okay. So let's go ahead and perform range of motion. Can you do active range of motion on your own? Perfect. Other way. Great. Go ahead and lift up for me. I'm going to check under your axilla and make sure there's no breakdown, any inflammation, profuse sweating. Okay. Go ahead and put that down. We're going to go ahead and do the other side. We'll do passive this time. Back again. Okay. Looks good. Now we're going to go ahead and check the other side for inflammation or anything as well. Okay. And we're going to check for sensation. Now go ahead and shut your eyes and put your arms out for me and just indicate where exactly I touch. Okay. And yes, that's correct. Your left arm, outer arm. Okay, your forearm. And your forefinger, yes. Okay, now other side. Okay, your left elbow. Okay, and your left pinky. That's great. Go ahead, open your eyes. Alrighty, that's great. We're going to go ahead and move down and check your heart rate. Okay, it's going to be ape to man. So we're going to go to the aortic pulse, pulmonic, Erb's point, the tricuspid valve, and at the midclavicular line in the 5th intercostal space will be the mitral valve, which is actually the apex of the heart, and there we would count the beats for up to 60 seconds, especially if they're on a heart medication. We're also going to be checking for any fluttering or abnormal heartbeats. Everything sounds good. Your heart rate is 73, so that's normal. I'm going to also take your blood pressure. Alrighty, so everything looks good. I'm going to go ahead and move down to your lungs. I'm going to check the rise and fall of your chest, make sure everything's symmetrical, not having any difficulty breathing. I'm going to take this time to check your pulse ox. Okay, 97%, that's perfect. Alrighty then. Okay, let's go ahead and listen to your lung sounds. And when I listen to your lung sounds, I'm going to count each inspiration and expiration. Okay, we're going to start at the sternocleidomastoid. Across and down. Across and down. Across and down. Across and down. I'm also checking for any wheezing, bronchi, crackles, any abnormalities of that sort. Okay, so I'm going to go ahead and have you turn on your side. I'm going to take this time to check the back of your head area for any bumps or abnormalities. And I'm going to continue to check your breathing in your posterior lungs. Across and down, across and down, across. Okay, everything sounds okay. No wheezing, crackles, or bronchi. I'm going to also check the bony prominences such as the scapula. Make sure that there's no redness there. Okay, I'm going to check. I'm going to go ahead and don gloves so I can check the sacral area. Make sure that the coccyx doesn't have any redness or breakdown. All bony prominences, the hip area. I'm going to lift the buttock and make sure that there's no breakdown or redness in between or any lesions. Do you have history of hemorrhoids? No? Okay. Everything looks good. I'm going to just uncover the bath blanket there. I'm going to look in the back of the patella, make sure there's no breakdown or eczema. I'm going to check the heel, make sure there's no breakdown there. Okay, everything looks good. Go ahead and turn back for me. I'm going to take this time now to check your abdominal area. And we're going to lower the head of the bed. I'm going to deglove, perform hand hygiene. Okay, so I'm going to check each quadrant. Top, across, down, and across. Okay, and I'm checking each quadrant for 60 seconds, and I'm checking for 5 to 35 bowel sounds, which is normal. Under the 5 would be hypoactive, and over the 35 would be hyperactive bowel sounds. I'm sorry, I need to reverse. I made an error. I was supposed to look first before I auscultated. So I'm going to rewind, and I'm going to look first. I'm going to check the area for any bruising, inflammation, any abdominal distension. Make sure everything looks okay. Then I would go forward with auscultating first, second. And then third, I would palpate the area. So just let me know if you're having any pain or any discomfort when I palpate several rows. I'm looking for any masses or again for any more abdominal distension, anything that may feel peculiar. Down to the umbilicus. Okay. Bladder is not distended. Everything feels good. When was your last bowel movement and urination? Okay. This morning? Okay. Before the procedure, that's good. Okay. So everything looks good. So now I'm going to go ahead and raise the head of the bed for you. And at this time, I'm going to check for JVD, both sides, make sure everything looks good. Okay, everything looks good. So I'm going to go ahead and move the bath blanket upwards so I can expose you a little bit here. Okay. Now again, I'm always checking the skin, making sure everything's intact, no breakdown or hives or anything of that nature. I'm going to go ahead and check femoral pulses, popliteal, and pedal pulses, as well as medial. Okay, everything feels good. I'm going to go ahead and check your capillary refill on your nail beds, the blanching, with the 3 seconds or less return. Okay, everything looks good. If you can flex back for me. Okay, push down as hard as you can. Okay, great. Let's go ahead and perform that range of motion. I'm going to pick up your leg here, bend it for me, no pain while doing that, right? And the other side. Okay, great. Now I'm going to go ahead and do what we did before. I'm going to check sensation. So if you can shut your eyes for me briefly and just tell me, indicate where I'm touching. Okay, anterior thigh, yes. Yes, your right lateral calf. Bottom of your right foot, good. Okay, now we're going to move on this side. Your knee, okay. Okay, your left ankle and your left big toe. Okay, great. Your sensation looks great. You can open your eyes now. And let me go ahead and cover you up. And throughout the assessment, I'm going to make sure that I clean and sterilize my equipment and stethoscope, or before the procedure rather. And I'm going to make sure that I never am within more than arm's length from the resident so that it could prevent falls. Alrighty then. Do you have any questions or concerns for me? No? Okay. Well, I'm going to make a note of everything. We got all your vital signs, your blood pressure, heart rate, respiratory rate with my watch, which is also a part of my supplies. And that's it. Thank you so much for your time. I'm going to go ahead and put up the bed to its original position and raise the side rail. And could I get you anything before I leave? Any water or nothing like that? No? I'm going to talk to the doctor. You should be discharging soon. Okay. Well, thank you so much. Ring your call light if you need anything. Okay?